Hello, this is your Chapter 18 lecture, and it is covering health promotion of the infant, birth to 1 year. And so, when we talk about health promotion is really what you're going to be teaching new parents or experienced parents about the first year of this infant's new life. And so, we're going to cover priorities in education. One of the things I would tell you right away that the most important or priority topic for health promotion of the infant is going to be safety. And so when you look at NCLEX style questions or also just knowledge in general, one of the most important things that you're covering with health promotion of the infant is going to be safety. And so in class, I would ask you safety about what? Sleeping, safe sleeping, also safety, keeping the baby low, not on high surfaces where they can fall. So any of those type of things. Also birth to the first year, certain milestones, and I would ask you, well, what is the purpose of milestones? We would then want to know, okay, if the child is not meeting these milestones, is there something that we need to assess? So, growth and development. So, this is the period of infancy characterized by fast growth and many, what I said before, milestones. And so, development, you have to understand, happens in expected series of steps, but also understand that no two infants are the same. And so, there are many different variations that may happen. You might have a preterm infant, you may have an infant born with certain disabilities. So, every infant is not the same, but we look at the milestones to measure, is the child meeting these milestones or is there something else that we need to address? Also understand that each infant has their own unique temperament and personalities. As you know, every baby that's born, they have a different temperament, different personalities. I always like to talk about my babies. So each one of them has their own different personalities. No two infants are the same, even twins. As I stated before, health promotion, we're focusing on educating the parents. So, what are we educating about? Expected development. Okay, so for that age, how much weight that should they have gained, or for their age, what should they be doing? And so, what type of reflexes should they be displaying? And we should also emphasize the expectation for each infant, and each infant again is unique, so no infant is the same. All right. One of the major things that we want to also educate parents about is keeping those well checkups, well visits as far as immunizations. That's really important because depending on their age, there are certain immunizations they should have from birth. One of them being is that vitamin K, which we talk about is for clotting, blood clotting. So that's the immunization that they should have before they leave the hospital. And so for each milestones, there are certain immunizations that they should have. There's a certain schedule that they follow. And it's important to remind patients or parents not to let those immunizations get behind track, because then we have to catch the infant up. Okay. Newborn growth period follows a rapid period of development, as we stated here. Newborn period is the first 30 days after birth with the infant, and then we have early infancy, which is 6 months. Older infancy usually is the second 6 months, ending at the child's first birthday. And then also toddler period is after infancy. And then with toddler period, that's when safety is really, really important. It's going to be very important for the parents to safeguard their homes, making sure that they have socket covers in place, making sure they have the gates in place if there's stairs in the home, so that the infant won't fall downstairs. So all of those things are very important when we talk about the toddler period, which we'll talk a little bit more about as we get more into peds. So, heredity and genetic influences. So, genetics is really the study of how our genes and chromosomes and genotypes or sequencing and combination of genes are expressed and responsible for health or disorders. And so, usually during fetal development in the infancy period, they're able to tell whether the gene there is a gene um, that is showing that will give us an indication of birth defects for a child. And so usually they're able to see that well before the child is born. We have what's called chromosomes, which are responsible for heredity characteristics. So, what color will the child's eyes be? What color will the child's hair be? Or what color will their skin be? How tall they are? Or what type of risk factors do they have for certain disorders? For example, you may have some parents that carry what we call the sickle cell trait, and so you may have babies that are born with sickle cell anemia, all other disorders. That's just one example of one. So I think for this lesson, though, we're not talking about certain types of disorder, but that's just an example. Okay. Some disorders are evident at birth, whereas others do not manifest until later. Okay, and so when we talk about genomics, we talk about how genetics influence the disease and how it's concerned with the structure and the function of genes. Sometimes that's why before children are born, some patients may do certain testings to find out if their child is going to be or is at risk for a certain disorder, such as Down syndrome and many other myriad of disorders that we could go on and on to talk about. But again, we won't get into the specifics of those disorders. That just gives you an idea of how genes and chromosomes are important when we talk about child growth and development. Heredity and genetics continue. So some patients or parents are what we call carriers, and so that just means that carriers are offspring who carries the defective gene but does not experience the symptom of the disease or disorder. So that goes back when we're talking about sickle cell disease. You may have a parent with the sickle cell trait, but they don't experience the disease, but their child will experience it because the parent is what we call the carrier. All right. So, really important. If one parent is a carrier, there is what we call a 25% chance that the child will have the disease. Again, if one parent is a carrier, there's a 25% of having the disease. And then we have a 50% chance of having a child who is also a carrier, and then a 25% chance that the child will not have the genetic trait. Okay, so those are just the certain risks that are present in a parent who what we call a carrier of the disease. We have so you have, and this is not AMP, but you guys should have learned this in AMP. You have what we call 22 pairs of chromosome. All right, and so you have 23. When you have autosomal dominant disease, you have a person that has 22 pairs of chromosome, and then you only have one defective gene. So if we have 23 chromosomes regularly, 22 means that one is defective. All right, and so only one defective gene or set of genes needs to be passed on for the child to inherit the condition. So some examples of those are osteogenesis and imperfecta, night blindness, as well. And then you have autosomal, what we call recessive disease or disorder, where both parents must pass down the defective gene. So again, you have autosomal dominant, where you only have one parent that has to pass on the disease, and then there's autosomal recessive, where you have to have both parents to pass that gene down in order for the child to be affected. Okay, so when we talk about sickle cell disease, you need to have two defective genes in order for the child to get that disorder. Other heredity and genetic influences, you have sex-linked disorders, where you have sex-linked disorders are carried on what we call the X chromosome. So you know you have two chromosomes. You have an X chromosome and a Y chromosome. So with sex-linked disorders, you have a X chromosome that's carried, and some are passed only by women to their children. So examples of those are hemophilia disease, which is a bleeding disorder. Then you have color blindness as well. When you have genetic abnormality, those are not inherited. An example of those are trisomy 21, and that's known as Down syndrome. And so that means that it affects the 21st chromosome, okay? And by the way, we won't expect you to know all the specifics of those. Some ones that would be really, really important to know about are Down syndrome, and then also sickle cell anemia. Just those two would be, I would say, very important. All right. All right, so now let's talk about the newborn period, physical growth and development. And so during that period, the infant is really susceptible to varieties of injuries, health problems, and so therefore there's a higher mortality rate than with any other period in life. And so in class, I would ask you probably what do you think is the highest risk around that time, and you probably would tell me SIDS, which is sudden death syndrome. All right, and so that's why it's really important. That's why I said at the beginning that safety is the number one priority when we talk about newborns. Okay. And so SIDS, I gave you guys the story in class, the unfortunate story in our family where a child was affected by SIDS. And so sleeping the baby on, not having like a lot of stuffed animals in the bed, making sure that the baby has a firm mattress, not a lot of blankets in the bed, and always back to sleep, so not on their stomach, and also co-sleeping. So we want to make sure that we encourage parents to make sure that they have the baby sleep in the crib around that age. All right. Also, really important is the transition to extrauterine life, so life outside the womb. All right. And so during that time, there's a lot of profound physiological changes, and then there's several factors that may interrupt that transition, such as born prematurely, also infants larger for gestational size. So all of those factors may interrupt that transition. So now we'll go through different body systems. Let's talk about the cardiovascular system. So when we're doing assessment for the newborn and we're talking about cardiovascular assessment, some things that are really, really important. We want to look at the color of the baby. So we want to assess the nail beds. You want to assess the baby's lip for cyanosis, which you know is that blue coloring. You also want to look at what we call mottling, which you're going to see at the bottom of the heels of the baby's foot. Edema, you want to make sure that you're able to assess that. That's sometimes that's a little bit more difficult to do depending on if the baby is a little chubby. So we want to look at edema of the hands and feet. Also any discoloration of the nail beds, and then what we call clubbing as well on the fingernails. Okay, all of those are signs and symptoms of circulatory distress. Inspect the baby's chest for what we call heaves and lifts. All right. You want to make sure that you're able to also take for heart sounds. And so remember, even with the adult, I told you guys before, the different areas of the heart, those you want to look at in the baby as well. Aortic area, pneumonic, moving down to Erb's point, the tricuspid valve, and also the mitral valve. It's not uncommon, though, in babies to have what we call an innocent murmur, but you do want to make sure that the doctor follows up on that. Normally, if it's a innocent murmur, it usually goes away when the child is between 1 and 2 years old. All right. You also want to evaluate the quality of the pulses and also the rate of the pulse. All right. And making sure this is a checkpoint here, knowing what the normal heart rate is for a newborn, which can go anywhere between the 130s to 160. Okay. So sometimes the heartbeat is going to be increased, and that's not a normal. Okay. You want to assess the rhythm as well. And then follow up with the, in this case, the RN with any abnormalities that you might find. Also, cardiovascularly, you want to look at or palpate the central and peripheral pulses. You want to compare them, all right? And you want to make sure that there's no pulse deficit. So all of them should be equal bilaterally, and they should be nice and strong, not too weak or thready or bounding, okay? It should be a regular rate and rhythm. So when we talk about thermoregulation is the process of maintaining the infant's core body temperature. And so one of the things you might remember or know about the newborn is that's sometimes difficult for them to maintain as they try to transition from intrauterine life to extrauterine life, all right, so outside of the womb. So one of the things that we do in order to make sure that we keep the baby warm is to always keep something on the head, because that's where heat leaves, okay? And so I'm going to just say some terms that you may have heard before, so it'll be important for you guys to look these up and know what they are as well. I'll say them slowly so that you can write them down. So evaporation. So what evaporation is the loss of heat as the amniotic fluid on the infant evaporates. And so that's evaporation. So that's the loss of heat. Conduction is the transfer of heat from the infant's body to cooler surfaces, such as towel or on the base of a warming unit. Convection deals with the transfer of the infant's body heat to surrounding cool areas or air. And then we have radiation, which is the transfer of the infant's body heat to a cooler object, all right, that the infant is not in contact with, such as a window or such, all right? So those four terms, make sure you know the difference between them. Evaporation, conduction, convection, and then also radiation as well, all right? So after birth, though, it could take up to 4 hours for the newborn temperature to stabilize, because babies, again, they are not used to living on the outside world. And so we want to make sure that after birth, that the infant is dried really well. Make sure that we swaddle the baby to keep them warm, okay? You want to have them swaddle, teach the baby or teach the parent how to swaddle the infant, okay? That's a nursing skill that you should be learning in clinical as well. And so when you go to clinical, ask Professor Sonny Thomas to teach you how to swaddle the babies, all right, or to tell you about that process, because that's very important. All right, and so again, the reason why it's so important is because we want to make sure that we assist the baby in keeping that thermal regulation system to keep the baby's core body temperature regulated. What happens though if the baby is not able to develop or not able to obtain thermal regulation? They may end up with hypoglycemia, so they can experience a drop in blood sugar if they are too cold, right? And so that's really important. So write that down, repeat it. It's really important. So if the baby is not able to have thermal regulation, they would have an issue with hypoglycemia, which is low blood sugars. Again, more on thermal regulation. In order to assess the baby's temp, you want to make sure that we're assessing what's called core temperature. And so the best way to do that is you want to do either a rectal or axillary, which is under the arm temperature. And so this is going to give us the best indicator of core body temperature for this baby. And so sometimes, well, the ranges, let me give you the ranges. So temperatures above 99.5 or below 96.8 should be reported, and an intervention should be initiated immediately. And so sometimes if the baby is too warm, so if it's above 99.5, we might need to just take the extra blanket off. Or if it's below 96.8, we might need to swaddle that baby to keep them warm. And that should take care of the temperature, or that should take care of the thermal regulation. But if the baby is not able to regulate that temperature, you want to make sure that you report that right away, okay? The respiratory system for newborn. And so because of the size of their head in relations to their neck, and it's not really developed, enlarged tongue, they are at risk for airway compromise. And so you want to make sure positioning. Again, you want to support the baby's head. Make sure that you are assessing this respiratory system regularly. Some of the respiratory system assessment should include looking at their color. Again, we're looking at cyanosis, the color of the lips, which is that bluish color, nail beds as well. And you also want to make sure that the baby has a pulse oximeter on so that we can assess that respiratory system regularly. If the baby is in distress, sometimes they may do blood gas assessments and hemoglobin as well, because as you know, oxygen is bound in hemoglobin, and so we monitor that to see what the patient's or the baby's oxygen level is. One thing though that will give you a key indicator of if this baby is having respiratory distress is you're going to look at the baby's abdomen. All right, and you're going to look at what we call retraction. So you're going to lift that baby's shirt up. You want to look at the bare chest and see if they're having what we call sternal retractions, or if they're breathing, that stomach goes in really, really, really deep and comes out very, very fast. All right. And so that'll give you an indication of their breathing or whether they're in respiratory distress. Again, that term is called retractions. We call them sternal retractions. Also, the baby will show you what's called nasal flaring, where their nares will just flare as well. All right. Listening to the baby, you want to try to listen to the baby when they're not crying, and so when they're listen to them when they're as quiet as possible, and you're going to listen for those what we call adventitious lung sounds. So you've heard of that term before, so we're bringing it back: adventitious lung sound or abnormal breath sounds. Okay, and some of those are going to include rales, bronchi, wheezing, and stridor. I would encourage you, I'm not going to mimic those sounds here because that would just be weird. I would encourage you to go on YouTube to look up those different sounds so that you're able to hear them and recognize them. If we were in the lab, I would be able to turn it on the mannequin, but you can also look on YouTube and look up rails, rhonchi, wheezing, and also stridor. Right. You also want to inspect for irregular respiratory rates and then also respiratory patterns as well. One of the things I would love for you to look up so that you're aware of what the normal rate and rhythm are the respiratory. All right, rate. The normal is 12 to 20 in adult, but in children or babies, it's probably going to be a little bit higher. Okay. Continue with the respiratory system. So, infants are what we call like nose breathers. And so they have very narrow passages that are easily obstructed by mucus. And so that's one of the things that sometimes that can be can seem very uncomfortable as a parent to watch is the baby having difficulty breathing and their nose is all stuffed up. And so I don't know if you guys have ever seen or are aware of those blue syringe or bulbs. You want to make sure you teach the parents how to use the bulb suction device. And then you want to make sure that they're able to not go too far back, but you want to have them create a suction, put it in the nose, the ear, and pull out. Okay. And so teach the parent how to use those to clear the baby's respiratory tract. I kind of said these things already. I'm looking at the lip color, the nail bed, pulse ox, blood gases. We talked about all of this already. So this is just a slide that reinforces what I just said. Okay. So make sure that you're looking at those nail beds, looking at the lips, and what color are we looking for again? If we were in class, I would ask you. But again, it's cyanosis, which is the color blue. All right. Again, I would encourage you to look on YouTube to listen to some of these sounds so that you're able to identify them when you hear them on a live patient. So the newborn period, physical growth and development, we're talking about the GI system. And so usually overall fluid requirements for the newborn and young infant up to 6 months of age is 125 to 150 milliliters per kilogram per day. So you don't want to introduce free water unless specifically being told to do so. Also, no solid food should be given or introduced until 6 months of life. Basically, that is because we don't want to alter the baby's fluid and electrolyte balance at all. Okay. Any formula given should be mixed with sterile water during the first few months of infancy to prevent introduction of unwanted microbes that lead to diarrhea. All right. And so, what's the risk of diarrhea if that happens? It was said in class again, fluid and electrolyte disorders. Okay. And so stool. So what should the baby's stool look like? So the first stool is called meconium. All right. And is usually passed in the first few years of life. The consistency is thick and sticky. It's usually a black or green color composed of amniotic fluid, mucosal cell, and then also ingested blood and secretions from intestinal lining. That's the first stool. After that, the transitional stool, as the meconium is passed, the stool changes to in color and consistency. And so sometimes it depends on like if you use formula or breast milk, that stool definitely looks and smells different. Okay. Traditional stool again is less thick and sticky, and the color is green, brown, or yellow. So breast milk, as I was stating before, that stool color is kind of orange yellow, and the consistency is soft and even, and it appears after the 4th day of life. Breastfed newborns will have several stools in one day. Okay. Formula stool. Usually the color and the odor of the stool depends on the formula fed, and the consistency is very soft. All right. And so that can be found on table 18-1. That's really important. So make sure you look at the difference between infant who is breastfed and formula fed, and what that stool kind of looks like. Okay. Anytime, if you have any questions, you can always email me, and then I'll be able to kind of help you with that. Okay. The GU system, so genital urinary system. So the newborn's bladder is able to hold about 15 to 20 milliliters. So if the baby is drinking, they should be peeing because the bladder can only hold so much. And so that's why when babies are sick and we ask them how many wet diapers are the babies wetting per day. So if their diaper is not wet, that's a problem. We could look at dehydration. The urine should be very light color, yellow, because their kidneys do not concentrate urine effectively, making them at risk for fluid loss and dehydration. So number one question that you want to ask mom, if we're thinking if the baby is presenting with nausea, projectile vomiting, diarrhea, we want to know how many wet diapers this baby has so that we can assess for dehydration and fluid and electrolyte fluctuations. So assessment for the genital urinary system. You want to make sure you look at the outer genitalia for hygiene and rashes. You want to inspect the quality and the color of the urine, and you want to use your nose to smell to see if you have any malodorous urine as well. Okay, and so those are assessments that are very important. Differences in the males urethra and females. Again, the female newborn's urethra is very short, putting them at risk for what? And if in class, you probably would say UTIs, because we talk about that a lot. So you want to teach the parents to clean the female's genitalia. Again, we're going to use the adult rule as well. We want to have the parents clean from front to back, okay? And we don't want to go back and forth. So one wipe down to prevent infection in that area. You want to have them inspect the quality and color of the urine, and then also to smell for any malodorous smells as well, as I stated before. The musculoskeletal system. So at birth, the newborn skeletal system has more what we call collagen, and so that usually is because the bone has not ossified yet. So rapidly, the bones mature and become less pliable. The musculoskeletal system is intact, and growth occurs via what we call hypertrophy and not hyperplasia. Hyperplasia is just excessive growth, okay? Hypertrophy is where it mends together. So you want to make sure that you handle the baby carefully, because if you don't support the head, like you guys remember, I had the mannequin, the baby mannequin in class. You want to support that head, okay, and make sure it doesn't flap around, because those bones can break really, really easily. All right. You want to inspect for skeletal deformities. Also inspect for bilateral muscle movements, and palpate extremities for masses and also deformities as well. Endocrine system. Okay, so the endocrine system is usually influenced by the mother's hormones. So again, endocrine system deals with hormones. Witch's milk and pseudo administration can occur, and so we want to make sure that we're assessing um, the baby for these things. Okay. Also, the newborn's blood glucose levels fluctuate widely as the pancreas is not fully developed, and so as we stated before, the pancreas produces insulin and it's not really developed in the infant, which is why if thermoregulation is off, they may have a problem with hypoglycemia. Okay. The pituitary gland secretes only limited amount of antidiuretic hormone, leaving the infant at risk for what? And you should all say dehydration. Okay. Assessment of the newborn's endocrine system includes inspection for symptoms of fluctuating blood sugars such as hypothermia, poor muscle tone, apnea, shakiness, poor feeding, and also lethargy as well. Okay, so all of those things you should look at. This is all in your book, so if you're trying to write really fast while I'm writing or stop in to record, you can read this all in your book as well. All right. So now we'll stop for a clicker question, and then I will let you answer this. So a mother verbalized, my baby seems so comfortable. He's been asleep for the past 4 hours. Upon evaluation, the nurse notices that the newborn is difficult to arouse. What should the nurse do next? A, praise the mother for doing a good job. B, check the blood sugar level. C, leave the room and check again later. Or D, shake the baby to wake him up. All right. So when we answer an NCLEX style question, I always tell you guys we want to look at the keywords in the question, which would be difficult to arouse, sleep for 4 hours as well. Okay. And then the stem of the question is we want to know what should we do. Next, I would eliminate the ones that I know are absolutely incorrect, and that would go to D. I'm going to eliminate that because we never shake the baby. C, I would never want to leave the baby alone, so we have to choose between the best answers, which is A and B, if we didn't know anything about what's going on. But based on what we're seeing here, I think the only obvious answer is B, as in boy. And I think I am correct. So newborns should be fed every 2 to 3 hours. Prolonged feeding intervals can cause hypoglycemia, making them difficult to arouse. Checking the blood glucose level is appropriate at this time. Praising the mom and leaving the room will not address the immediate concerns. All right, and so you always want to ask yourself in a priority, what is going to help this baby the most? And that would be your assessment, which is checking that blood sugar. The integumentary system, and this is the baby's skin. And so one of the things I would say about baby skin is they're very fragile. You want to make sure that because the baby's skin is so thin, we want to prevent from having skin tears. All right. Any topical medications or ointment will be readily absorbed. You want to make sure that the skin is cleaned gently but thoroughly to prevent tissue injury, rashes, or tears. The infant is also at risk for skin breakdown and should be evaluated regularly. So you want to make sure that you assess that skin for skin breakdown. And then also you want to teach the parents to make sure that we're changing the baby at least every 2 hours, 1 to 2 hours, to ensure that urine is not just sitting on the child's bottom. Right. Again, you want to assess for rashes, clots, sebaceous glands, and then also any bruising as well, and palpate the skin for lesions and masses. The neurological system. So the baby's neurological system is still developing. Okay. And so in the neurological system, maturation of the neurological system takes time because the newborn has immature nerves. And so this baby is still developing. Usually, a term called myelination is the process where you have the myelin sheath that's growing around the nerve fibers continuously during what we call cephalococcal proximal distal development. Ooh, that's a tongue twister. Okay, so during this time, what happens is the young infant slowly masters what we call movement. And so that's why sometimes we're going to assess for different reflexes. So Babinski's reflex, which should be present in a child, where you stroke the bottom of their feet and the toes fan backwards. That is always present in a child up until the age 2 years old. The rooting reflex, where you stroke the baby's cheek and then they turn their head to the side that you're stroking. And then also the startle reflex as well. And so all of these reflexes are developing as the infant ages. All right. We won't go into a lot of that. I think you guys are going to get more of that when we go deeper into pediatric, but just know that those reflexes are still developing as the baby ages. Look, I just talked about this. You want to inspect for primitive reflexes and for equality and symmetry of movements. All right. Also, there's sensory organs, so we can't talk about neuro without talking about sensory. Most newborns have intact olfactory, which means that they can smell. They also have intact tactile and taste and hearing abilities, but vision is not yet mature. All right. So vision is not mature yet. And so sometimes you might notice that the baby may look like they're going what we call cross-eyed because they're trying to focus there. And it makes it difficult to accommodate on an object. But they will develop that. Parents are encouraged to hold their infants close, known as face position. Newborns' sense of smell is well developed. They can smell mom a mile away. The newborns are able to react strongly to unpleasant odors and can distinguish between mother's breast milk or someone else's. That's awesome. All right. And they will cry for their mother's milk. And their mom also has a unique scent as well. So they may not be able to say they want mom, but they know who mom is, the way mom smells. And so they use their senses. So nutrition, and if we were in class, I would ask you, well, what milk is the best milk for the baby? And you would always say, what? Breast milk. Okay. So the newborn starts with breastfeeding or formula exclusively until 6 months of age. So that's all they should have is formula or breast milk. Although breast milk is the best. Why? Because they have a lot of antibodies that protect the baby. And we should, if possible, encourage mom to breastfeed. So feedings should number about 8 to 12 per day in the newborn period, and then slowly become larger and less frequent. Foods are introduced one at a time, and that's only after 6 months. Okay. You want to make sure also if mom is pumping the breast milk for storage. So breast milk can be stored in a freezer with its own compartment for 3 to 6 months. All right. So it can also be in a refrigerator compartment for 4 to 5 days, in an insulated cooling bag for only 24 hours, and at room temperature 6 to 8 hours. Really important. So make sure that you look at those parameters. That is in your book under breastfeeding. All right. So after the age 6 months, nutrition, green leafy vegetables are introduced after cereals are well established, followed by yellow and orange vegetables. And so You want to make sure you try to introduce those early, because as children age to be toddlers and preschoolers, they begin to get really picky eaters. And so you want to make sure that they have those vegetables. Parade fruits are introduced one at a time. After eat vegetables is well established. You also can start lean meats and egg yolks at about 6 months. Is that 6 months? Let me see. Let me make sure. 6 months of age, yes. Okay, but not before then. Also, Table 1830-3 gives calorie requirements. And so, developmental age from 0 to 30 days, the baby should have 100 to 110 calories per kilogram per day. From 1 to 4 months, 90 to 100 calories per kilogram per day. 5 months to 5 years, 70 to 90 calories or kilograms per day. And then older than 5 years, they should have 1,500 calories for the first 20 grams of weight, plus 25 calories for each additional. All right. So why do we set requirements? A couple of reasons. Number one, we want to make sure that the baby is gaining weight adequately. And then also, as we, during this day and age, we want to prevent obesity in children, which can cause other issues as well. Okay. Cow's milk should not be given till after 12 months, and that's regular milk that you buy in the store, because it can cause inflammation and microbleeds in the intestine. And consuming more than 32 ounces of cow's milk a day may contribute to milk anemia. Whole milk should be given for the first 2 years. And I know, as adults, sometimes we drink like 2%, 1%. Children, though, they really should have whole milk for the first 2 years of life, starting at 12 months. And then sometimes if the children are lactose intolerant, they should have soy milk or almond milk as well. I kind of said all of this, so I won't repeat myself. But again, breast milk is the best milk and is recommended for all infants for at least the first year of life. If the baby has to be in the hospital, you want to make sure that you encourage mom to pump that milk and then have it stored according to the criteria that I gave you in the last slide. An infant's health status may require formula feeding. So while we want to encourage breastfeeding, sometimes moms can't for whatever reason. And so we want to make sure that they are able to choose formula as well. Infants require formula for the following conditions. So these individuals cannot breastfeed: enteral tube feedings, anatomical abnormalities, gastrointestinal diseases, and severe failure to thrive as well. All right. Mothers may be unable to breastfeed because of birth-related injuries, breast disease, or infection, certain medication, or the inability to produce milk. Formula, it should be fortified with iron and prescribed by the healthcare provider. And so we want to make sure that we give only the infant formula that is prescribed by the physician. And so you want to make sure as well to note that all formulas should be mixed with sterile water, and the baby bottle should be warmed in a bottle warmer or water bath. Okay. We want to have safety. Make sure that the parents test the formula before giving it to the baby, so that they don't get burned from being too hot. This is just more about formula. Again, we want to make sure that we give the formula that is prescribed by the doctor. To calculate the infant's formula needs, you want to begin with the quantity of calories needed and then multiply by the infant's weight in kilograms. And you want to make sure to divide the number of calories needed by the number of feedings per day to determine whether calories are met. Okay, so I'm not going to probably test you on that, but you want to make sure that you note how much formula is required by kilogram and by weight, and go from there. Culture can have play a big part on decisions about whether to breastfeed or bottle feed. The introduction of foods, however, though, again, we should stress that that needs to be not more than 6 months. But culturally, I can attest to this. Sometimes, depending on the culture, they are inclined to give babies food earlier, but we do need to educate in regards to that. And so just know that culture highly influences the family's beliefs about when the baby should get food, but for safety reasons, food should only be given at solids should only be given at 6 months. Let's talk about sleep patterns. So this is one of the things that can be really stressful for new parents, because sometimes baby sleep schedule is off. But here are the requirements. Young infants require about 22 to 23 hours of sleep a day for the first week of life. Rest is imperative for health, growth, and development. Older infants require about 16 hours of sleep a day, including 2 nights. And typically, an older infant will nap for 1 to 2 hours in the morning and then later on in the afternoon as well. Sleeping patterns and requirements continue. You want to make sure that you teach the parents to schedule the child's nap earlier in the day to avoid the infant staying up too late. And so sometimes you have to train that infant to sleep, or let them sleep. Don't let them sleep too long. It might be tempting because you want to get more things done, but you want to make sure that you have them sleep earlier during the day to make sure that their night sleep schedule is not off. Infants should begin to sleep through the night at 4 to 6 months. And so, again, as we stated earlier, every infant is different, and it varies. So you want to teach the parents that each of their children will be unique when saying that they can when they begin to sleep through the night. Separation anxiety is a real thing. And so it's a situation in which the child expresses anxiety when a parent leaves or when the child is taken from the parents. Usually starts between 8 to 10 months. Again, depending on the milestones, they can vary in children. Usually it intensifies at about 12 months. Therefore, going to bed becomes more difficult. And then it's especially difficult in children who may have had trauma as well. And so in order to combat this, we want to make sure that we use consistent bedtime routines and provide a safe bed. Also, you want to place the infant on his back to sleep to prevent sudden death syndrome. Do not place pillows, stuffed animals, blankets. We said all of this before in the bed as well. To help the baby sleep, you want to make sure that we dress the infant in a warm fleece or a onesie. Do not place the baby on a waterbed to sleep. So we want a hard surface. Cold sleeping can cause injuries. I've heard of stories where The parent rolled over on the baby, so it's not good. You want to make sure that you put the baby in their bed to sleep, on their back to sleep. Don't use an electric blanket in the crib, which that can also be an issue with fires. You want to make sure not to leave the TV on and provide a consistent, positive sleeping situation that the baby can get used to. It helps to have a bedtime routine with positive interaction, and you want to help the infant feel safe and secure at bedtime by using a nightlight as well. Physical growth and development. And so this is really important. I would highlight this, write this down. It's very important. Infants should triple their birth weight and double their length by the first 12 months. I'll say that again. Infants should triple their birth weight and they should double their length in the first 12 months. Infants' weight increases about 1.5 pounds per month for the first 6 months of life, and then increases to about 0.75 pounds per month for the second 6 months of life. They should be gaining an average of 1 inch per month, and in the first 6 months, reaching an average of 29 inches within 12 months of age. Anthropiometric measurements are on the measurements of the child's growth, including height, weight, and then also circumference as well. And so you probably, in your book on page, I believe, let's see which figure this is. Figure 18-2. It has the head circumference and weight for length percentiles. When you measure the child's weight, they look at it in the percentile, okay? And so that's really, really important. So, and they use that to determine if the child is the right height and weight given their age by percentile. And it measures how many children of their age are in that, and they compare to the children within their age in that percentile as well, okay? Factors influencing the physical development are heredity. Some babies are larger. Their parents are taller and more broader, and so their height and weight will be affected by genetics. The infant's nutritional status and overall health also affects physical development, along with cultural factors and growth patterns as well. So sometimes there are growth spurts and growth lags. It'll seem like overnight this baby had just shot up like what they usually say a leaf or a branch. Also, other factors influencing physical development, premature birth. So if the child was premature, sometimes they're going to be a little bit behind the growth curve. And so just remember that each child is different, okay? So we use criteria as the standard to measure, but each child is unique in its own way. So physical growth and development is usually plotted from birth to 3 years, and the measurements are interpreted as percentiles, as I stated before. So measurements within the 5th and 95th percentiles are considered acceptable. And so the infant's occipital frontal circumference is measured at each visit. So what that means is they take the measuring tape and measure from the top of the head, the back of the head coming to the front. And it's measured on the growth chart, and it should increase by 0.5 inch per month for the first 6 months. The average value for the head circumference is 17 inches by age 6 months and 18 inches by 12 months. And so the infant's posterior fontanelle should close between 2 to 3 months of age. So the frontanels at the top of the head, sometimes you'll see it rise and fall. If you look, sometimes we call that the soft spot. But those fontanelles should close at age 2 to 3 months. Sometimes a baby can have what's called sunken fontanelles, and sometimes that is indicative of dehydration. And so they'll look at those to determine also the health status of the baby. So fontanelles are unique and allow the infant's cranium to expand or contract during the birthing process. The chest circumference is usually measured at the level of the nipples and typically measures 2 centimeters less than the infant's head circumference. During the first year, the 6 to 8 teeth are produced. So again, during the first year of life, they have 6 to 8 teeth, with central incisors erupting at about 5 to 7 months. It's really important during that age group that teeth begin to erupt, that you take them to the dentist. They also should have their teeth cleaned with a damp cloth as soon as they erupt. Infants should be weaned from the bottle by 12 months to promote good oral health and to also prevent cavities as well. I kind of alluded to this earlier. So normal vital signs, these are very, very important. Why are they important? Because we are also measure the child's current vital signs to what the standard is. All right. So the regular heart rate for an infant is between 120 and 160, as I stated before. In the newborn period, it slows to about 100 to 120 in the first year. All right. Respiratory rate, as I alluded to before, respiratory rate in the infant is 30 to 60 breaths per minute and fluctuating greatly in the first few weeks of life. Axillary temperature should range anywhere from 97.7 degrees Fahrenheit to 99.5 degrees Fahrenheit. Usually blood pressures in children are lower considerably, and so it ranges from 50 to 75 systolically, which is that top number, to 30 to 45 diastolically, which is the bottom number, and this will raise drastically within 12 months to about 90 over 60, which it should be. The infant metabolic rate is about almost as twice as that of the adult. And so infants require more calories, nutrients, and water for their body size as compared with an adult. So basically, that's why fluid balance is really important. And we stated before that the baby should not get free water unless specifically told to give that. And we need to make sure that we're not giving them regular food until 6 months. So it's really important. Also, we want to make sure that we promote fine motor development through play and pincer grasp, which is where you put the baby's hand in your finger and the baby will grab your finger. All right. And that's usually mastered by 7.5 to 8 months. That's important. It can be encouraged by providing a food treat. Constant supervision is required when they begin to start to move around. That's called locomotion. So remember I said before, infant development, what's really important? Safety. We want to teach safety guidelines to new parents. Number one, support the head while handling the newborn. All of these things are here. You can read these. Maintain an appropriate body temperature for the newborn. Lay the baby on their back to sleep. I can't emphasize that enough. Never drink hot fluids or liquids near or above the infant. Use bulb syringes to clear secretions from the nose and the mouth. Practice safe handling while changing the infant's clothes. Use appropriate, approved, properly installed newborn ready latches. Prevent falls, burns, suffocation, and sunburns, animal scratches, and other home injuries. Never, ever, ever, ever shake a baby. And so we hear of what's called shaken baby syndrome, and it's a real thing. You want to make sure to teach patients coping strategies, that if they are feeling overwhelmed, give them support numbers to call to get support, and make sure they have a support system for that baby. Now we'll start talking about some of the cognitive development. A lot of these theories you should have gotten in your lifespan class, or if you've taken a psychology class. So I won't go through a lot of these, but I will just highlight the different theorists. The first one we'll talk about is Pagiat, which is a theorist of cognitive development. And so what Pagiat believes is that the infant experiences sensory-motor period where the infant begins to discriminate between persons, comprehend words, and learn what's called object permanence. And what object permanence means, that the infant knows it's there. It's almost kind of, in a sense, playing peekaboo, right? And so they know the face is there, but it's object permanence. You cover it and the face is gone, okay? So she believes in that they're able to discriminate between persons, and then also comprehend words and learn object permanence within the first, I want to say, few months of life. Freud, which you guys, Sigmund Freud. So you've probably heard a lot about Sigmund Freud, who believes that the infant experiences the oral stage where everything goes into the mouth, and they find enjoyment and pleasure and satisfaction through the mouth. So everything that the baby picks up, where is it going to go? Right to the mouth. And so more of their theories are outlined in figures 18.5 and table 18.4. So I won't go through all of those. You can take time to read those, but I would look over those so that you would know them, okay? Because you should have had that already, so I won't teach that. Communication, how do they express? So they're going to start cooing at about 1 to 2 months, and it's the cutest thing. Laughing at 2 to 4 months, and then consonant sounds, maybe they'll say mama or dada, about 3 to 4 months old, and imitative sounds. So you say something and then the baby will make that sound back. Sign language can be introduced for parents with members who are deaf, and you can actually teach them as a kid. 12 months, usually syllables that hold meaning to the infants. Mama, and I said that before, dada. I said about 6 months, but it's actually 12. But again, some babies, they begin talking. I have niece and nephew twins that they begin talking maybe at about 7, 8 months. And so it is individual to the child. Interactions with the primary caregiver is easy and effective way to learn language. Also around this age, they'll begin to explore. Also, they have what's called stranger anxiety or stranger danger. So they won't go to people that they don't know. Psychosocial needs. So Erickson was big on this theory, where one stage has to be mastered before they can go to the next stage. But so Erickson's had a really strong psychosocial theory, and so this isn't based on Erickson's, but I just thought of that because we're talking about psychosocial now. And bonding is the process of developing meaningful relationships between the infant and the caregiver. Bonding provides a sense of security and must be encouraged right after birth. And so that's why we do skin to skin. So when the baby is born, they put them right on mom's chest, or sometimes dad's chest too. And the infant's sensory organs assist in recognizing the parent and developing this bond, okay? All right. Got a question here. So after evaluating the head of a 6-month-old infant, the nurse documents that all findings were within normal limits. What information did the nurse most likely evaluate? 6 months old, palpable posterior fontanelles, head circumference of 17, head circumference of 18, or non-palpable anterior fontanelles. And so I can look at one right away that can be eliminated, but I will let you choose. The answer is B. The average value for a head circumference is 17 inches by 6 months and 18 inches by 12 months. The infant's posterior fontanelle closes at 2 to 3 months of age. The infant's anterior fontanelle closes at 18 months of age. So knowing those milestones would be very good. If you need to stop in between and get something to drink, I would encourage that. I'm going to get me a little bit of something to drink here. Anticipatory guidance includes education about what to expect and how to plan a safe and healthy environment during infancy. And so it tells us to look at box 18-4 for information about how to educate parents. So I would encourage you to look at that. Health promotion in infancy. We want to teach about adequate nutrition, appropriate sleeping, and balance between play and napping as well, which are very important. All right. Some of these we kind of talked about a little bit. We want to make sure that we talk about proper hygiene. Also, bonding, which we kind of talked about that already. Well child checkups and immunizations, making sure that we know that schedule. Dental care, we talked about that. When those teeth begin to erupt. Pacifier safety. What did they say about pacifier? Usually pacifier safety, you want to kind of discourage that as the teeth begin to grow in, to make sure that that it doesn't, number one, mess with their teeth, but number two, make sure that the pacifier is also safe. They talk about use of a one-piece pacifier. Okay. So pacifiers, so specific guidelines should be followed if a pacifier is introduced to an infant. Only pacifiers that are made of one piece of plastic should be offered to the infant to prevent a teething infant from chewing the pacifier into parts and creating a choking risk. You want to also obtain parental permission before introducing a pacifier to the infant, because some parents do not want pacifiers to be given to their infant. So remember that. And they're also hard to, sometimes some children, it's hard to take the pacifier away as they get older. Teething. About 6 to 8 teeth will erupt during the first year of life, and sometimes they can be painful. You want to make sure that the patient and they can also get a little bit of a fever while they're teethed as well. Teach parents to expect discomfort and provide ideal comforting for the infant, which can be maybe popsicles, soothing, gum, cream, as well. Teething rings should be used under supervision. Allowing the infant to chew on other items may cause choking. We want to clean the teeth with a wet washcloth. Fluoride toothpaste should not be used because of the possibility of poisoning. Okay. Again, after 6 months, the baby should be weaned from the bottle, but formula-fed infants must be weaned, again, completely before the first birthday. Juice and other sweet beverages are never to be given through a bottle because they can cause tooth decay as they suck on that. Bottle of water may be given to an older infant at bedtime, but should be removed from the infant after they fall asleep. And so this is just safety stuff that's important. We kind of talked about the pacifier. I'll go past that. Safety for the home. You want to make sure that you perform a home safety sweep before an infant is brought home. Babysitters and other child care providers must be able to prevent injuries and respond to emergencies rapidly. So they should be CPR trained. There should also be monitors in the home, safety sockets, locks on doors where there's medicine. All of those things should happen. You never also want to leave an infant on a high area alone because they like to jump and climb as well. Look, there we go. So don't leave infants alone, which in things like high chairs, tables, bouncy chairs, all those things. Sun safety: do not apply sunscreen of any SPF to infants younger than 6 months because their skin can absorb that. All right, and they don't need those chemicals. Choose a stroller, child backpack, or carrier with a sun protecting hood. So that the skin isn't burned or the infant won't have sunburn. Toy safety. You want to make sure that the toys are age appropriate and no loose things hanging off of the toys. Supervise younger children when playing with older siblings and their toys, and so toys with strings to prevent strangulation as well. And so you want to assess those toys for safety. This is really important. So cribs, you want to make sure that older cribs with peel and paints, get those away because you don't want them to get lead poisoning. And space between the crib slats should not be wider than 2.5 inches. Highlight that. That's a question you will see on NCLEX and probably on the exam. So again, space between crib rails or slats should not be wider than 2.5 inches. If the crib has wheels, you want to make sure that they're locked, and then also a firm mattress. No blankets, toys in the crib. Car seat safety. Children should be in a rear-facing car seat in the center of the back seat. And then you want to choose a certified car seat appropriate for the age and size of the child as well. Sometimes like fire department, things like that can help lock those car seats in and do all of that for you. Special needs children or those with orthopedic devices such as spica casts need a specialized car seat. Children should never be left unattended or unsupervised in the car even for just a few minutes, because kids move quickly and it could be dangerous. All right, we got another question here. The nurse is educating the first-time parents of a newborn about anticipatory guidance. Which of the following information is incorrect? And so this is called the negatively worded question. A, supervise the infant when around other children. So that's probably true. So we're not looking for that. Do not apply sunscreen on the infant. C, remove all toys and blankets and bumpers from the crib when laying the infant to sleep. Allow the infant to bottle feed until they fall asleep. So what is incorrect? You guys tell me. The answer is going to be D, because we don't want them to have anything in the mouth while they're sleeping. And also it's a risk that their teeth may be decayed as well. Well child checkups and immunizations. You want to make sure that you're keeping up with you're encouraging the moms to keep up with their immunizations, to stay on schedule. Immunizations are given to the infants to help produce active immunity against different diseases that can be acquired. The purpose of the immunization is to prevent acquisition and the spread of diseases and their complications. You can look at the CDC for more information about that. Immunization may take weeks or months to have full effect, but others offer lasting protections against specific infectious diseases as well. So we want to make sure, again, that we encourage parents to stay on top of their immunizations and document any questions and any discussions of concern, refusals, or delays. You want to make sure that before you give an immunization that you get informed consent as well. And then we also can look at the CDC for any guidance. All right, there's another question. I'll let you guys answer that on your own. Identification in the hospital. You want to make sure that all hospital infants wear our identification band and that it matches the parent and it has a medical band on it as well. Also, if there is a food allergy, you want to make sure that you look at that. Okay. In order to prevent infections, you want to make sure hand washing before all patient contact. Use aseptic technique during any medical procedures. Young infants are considered immature and are at higher risk for acquiring infection. So that's why we have to encourage everybody to wash their hands when dealing with the infants as well. Care must be taken when dressing the infant to ensure that limbs and necks are protected. So you don't want to cause a fracture by pulling on the arm. So you want to make sure that you take care to protect the baby's ligaments. Make sure that we are protecting also thermoregulation as well, and making sure their body temperature is stabilized during medical procedures. Okay. We're going to use blankets to make sure that we keep the baby swaddled. Check their temperature. If it's too high, you can remove some clothing. If it's the temperature is very low, you want to swaddle that baby. You want to make sure that you read the hospital policies in regards to infants sleeping in large hospital beds, which we don't condone that. You want to make sure that the baby stays in the crib, okay, appropriately sized crib, and keep the rails up to prevent falls. Safety in the hospital. Remind patients to have all infant supplies readily available and within reach so that they do not turn their back on their infants. Weight-based calculations. So you should be learning about how to calculate pediatric doses. It's really important that you calculate the correct dosage that the patient is to get by weight, because medical errors can be have serious consequences for babies. And in pediatrics, we always have the nurses double check any medications that they give for a safe dose range. Here are more questions, which I will go past. Ear infections. So ear infections are not uncommon, but usually the infection of the middle ear is common in infancy and early childhood between the ages of 3 months and 3 years. And it actually is inflammation in the area of the ear behind the eardrum caused by Streptococcus pneumoniae. And so sometimes, you want to make sure prevention includes promoting breastfeeding, and then also making sure that if they're bottle feed, that the infant is sitting up in the right angle. Okay. Aspiration risk. Infants are at a high risk for aspiration because of their teething and anything that they're putting in their mouth. Carpet and wood floors must be kept free of debris as well, because it's going to go right in their mouth. Remove plastic bags from the infant's reach because of the risk of suffocation. And then also crawling infants must be kept away from boxes and things like that because they can suffocate. Drowning is a real issue as well, so you want to make sure that you don't leave the baby in the bathtub unattended. Crawling infants can fit through pet doors or faculty gates and fall into swimming pool. So you want to make sure that you hold the infants while bathing them and stay within their reach to keep them from getting into deep water. For poisoning, the number one thing you want to do is call the Poison Control Center. And so the most common poison supplements or materials are cosmetic, household cleaning supplies, topical products, and pesticides, and also chemicals. You want to make sure we keep all those things locked up when you have children. Also, childproof container and locked cabinets, so in case babies get in there. And then also, you want to instruct parents to call the poison control center if they suspect any poisoning. Guidelines for burns: you want to make sure you never microwave formula. Also, you want to make sure when you're putting the babies in the bathtub to check your arm first to see that it's not too hot. But also, hot water heater should not be set above 120 degrees Fahrenheit. So make sure you write that down as well. Another clicker question, which I'll go past. You can do those later. Disorders of the infant. I'm not going to go through all of those. You can read those in table 18-8 if you would like. Okay, and the last clicker question: which of the following are helpful for preventing SIDS? Select all that apply. A, smoking in the home. B, infants in prone position. C, warning the patients that having a sibling who died from SIDS put the infant at risk. And D, laying the infant on their back when they're sleeping. So it's select all that apply. The answers is C and D.